All right, y'all, welcome back to Level the Playing Field. I've got some more orthopedic knowledge for y'all. I want to talk about one of the most common ailments that affect patients I see, and that's arthritis. So like and subscribe, follow along. Let's get into it. So one of the most dreaded diagnoses that I give people is arthritis, and everyone is afraid of having what they call bone-on-bone arthritis. And what that means and how that's going to change their health, how it's going to affect what they can do. So I want to take a few minutes to go over the basics of what arthritis is, because we throw that term around a lot, and we sometimes need to put some more depth into what that really means, so we have a true understanding, because there's different types of arthritis. You can get arthritis in different places. So let's break down what the vocabulary actually means. I want to start with this part. Anytime in medical technology, or terminology, that you hear the term itis, what we're saying is inflammation. So if someone says they have tendonitis, they're saying I have inflammation of my tendon. If someone says they have a bursitis, you might have heard that term for like hip pain. That's inflammation in your bursa, which is a small area around your hip. If someone says they have arthritis, the arthro part of it refers to the joint. All right, so they're saying there's inflammation within a joint. So inflammation within a joint is what the basics of the term arthritis means. Now, that's the basics of the vocabulary itself. In terms of what it actually means from a medical standpoint, arthritis refers to an inflammatory condition which is affecting the health of a joint. And it can manifest in a few different ways, but the most common way it manifests is ultimately the loss of cartilage inside of a joint. The cartilage is kind of the smooth surface inside of a joint that lets it move like a bearing surface. You might think of it, some people call it the gristle when you're having, some chicken, if you eat chicken, right? So that kind of gristly part at the end of like a drumstick, that's cartilage. Now inside of your body, that cartilage acts like a bearing surface for your joint, kind of a lubricating system that lets the joint move smoothly. So think about your knee joint being like a hinge. In between the two bones that form your knee, the femur, your thigh bone, and your tibia, the shin bone, there's cartilage, which is that smooth surface that lets it move and move without range of motion. So the hinge can move without being stopped or getting stuck. So again, like I said, while arthritis is kind of a big picture thing, one of the most common manifestations for it to cause you pain is because of the loss of cartilage in between the joint. And for a lot of people that, kind of creates a lot of symptoms and pain, but we'll get back to that. So looking at things from a larger standpoint, there are several different types of arthritis. Now you've probably heard the term osteoarthritis. Osteo standing for bone. Osteoarthritis is the most common form of arthritis we talk about. So when someone just throws out the term, I have arthritis, most of the time they're saying I have osteoarthritis. So osteoarthritis kind of pertains to a more focal or localized joint involved. So people usually have osteoarthritis in kind of one joint or maybe another joint. So when someone says I have arthritis of the knee, they're probably saying they have osteoarthritis. That osteoarthritis, again, leads to, in some people, a loss of cartilage inside of the joint. So loss of cartilage leads to loss of ability for the joint to move smoothly. It causes severe inflammation inside the joint. So people may feel things like swelling, catching feeling, I can't move my knee properly, I get stuck. People also describe something called startup pain, like it's hard for me to get going in the beginning. Once I get a few steps, I kind of get my joint lubricated and I can start moving. That's called startup pain. A very common complaint when it comes to osteoarthritis. Now, up till recently, we thought osteoarthritis was kind of like a wear and tear situation. We thought, you use your joint a lot and eventually it wears out, kind of like, tires on a car or something like that. That's not necessarily exactly the whole story. As it turns out, this thing's a little bit bigger than we really understood it at first. So a large part of whether or not you're gonna get osteoarthritis, let's start with that, is genetic. That's bigger than us. So it's what you got from your parents and their parents and their parents, right? Genetics increases the risk of arthritis. So if, on your mother's side, a lot of people have had issues with joints, you may consider, that you may have that issue too. Same with your father's side, all being genetic. Now, another cause is what's happened to your knee throughout life. So while wear and tear might play a role, also major things happening to your joints plays a role. So I'll take you back to sports medicine. If we look at ACL injuries, even if we fix them, increase your risk of getting arthritis in that joint, in that knee joint dramatically. And that's because the fact that you even tore your ACL in the first place causes severe damage to the cartilage that we can't even see. And that damage can manifest later in your life. and cause that cartilage to kind of wear away with time and cause inflammation, what have you. That's a whole nother subject and probably requires a whole nother video, but that's an example of how something can injure your knee and lead to arthritis. Now, in that setting, that's a special kind of category for osteoarthritis, which we would call post-traumatic arthritis or post-traumatic osteoarthritis. So you have arthritis because something happened to you traumatically, post-traumatic, and that led to the loss of cartilage, therefore the post-traumatic osteoarthritis. The next part, this doesn't get talked about a lot either, is being overweight. So increased weight hurts your joints in several different ways and can affect your risk for arthritis. Now you might imagine kind of straight up, more weight, more pressure on the joint causes things to wear out faster, and that probably plays some role in it, and it makes sense logically. From a bigger standpoint, what we understand about when we have a large amount of fat around our body, fat deposits throughout your body can actually affect your joints because it creates inflammation or changes the way your body responds to inflammation, and that inflammation can affect your joints. So in that sense, being overweight can actually affect and increase your risk for developing arthritis, in this case, osteoarthritis. So as I pointed out in the beginning, there are other types of arthritis to consider. We talked about osteoarthritis and the subtype of post-traumatic osteoarthritis. But what about more what we call systemic arthritis? By systemic, I'm saying things that affect your entire body. Now, osteoarthritis has some components of that, but some types of arthritis more so affect your whole body in ways that are much bigger than that. So I'm talking about things like autoimmune conditions. Autoimmune referring to when your body is in essence attacking itself. So rheumatoid arthritis is the most commonly talked about version of this. Rheumatoid arthritis is when, for reasons that might be genetic or might be environmental, we're not always sure, your body has increased amounts of inflammation throughout it. And that kind of relates to, your body almost attacking itself to an extent. With rheumatoid arthritis, it's not just one joint that's usually involved, it's frequently multiple joints that are involved. So while the underlying cause is a bit different from osteoarthritis, what's happening inside the joints has a lot of similarities. So when it gets to its most severe phases, you might see the cartilage start to wear out and people develop that bone-on-bone, condition we talk about, when the cartilage is gone and there's no more lubrication or no more lubricating surface in between the bones of the joint. Rheumatoid arthritis attacks different joints in different ways than, say, your standard osteoarthritis. So what people oftentimes see is arthritis, affecting the joints in the fingers. So people will get lots of swelling around their knuckles with rheumatoid arthritis. It can even affect your neck, right? So arthritis in the neck can happen to anyone, but with rheumatoid arthritis, that risk can be higher. Arthritis in the neck can actually pinch on the nerves coming out of your neck, which can then affect the strength in your arm, right? So as you can see, arthritis can do a lot of different things to your body. So rheumatoid arthritis is an example of kind of an autoimmune version of arthritis. Another version you might have heard of is called psoriatic arthritis. Psoriatic arthritis is a similar idea, but your body actually manifests that inflammation, that attacking itself, in other ways as well. So when someone has psoriatic arthritis, they oftentimes have psoriasis associated with it. Psoriasis being when people develop these kind of plaques, usually over the extensor, like the bendable aspects of their joints, like the elbow or the knees. People with psoriasis can also develop arthritis in different joints because that inflammation that's affecting their skin can also affect their joints. Does that make sense? So you can have arthritis just because. You can have arthritis because a traumatic injury happened to you. You can have arthritis because of an autoimmune or inflammatory process going on inside of your body. The last one I'm going to give you is, you probably heard this one before, gout. We call it gouty arthritis, but gout is good for short. Gout is when your body actually deposits a whole bunch of ammonium throughout itself. And it can develop, for some people, randomly, genetically, but for some people, it'll happen because they, for instance, eat a lot of meat or they drink alcohol on a regular basis, okay? Your body will develop a situation where actually we create crystals from those chemicals, and those crystals can actually deposit themselves, leave themselves inside of your joint. Now your body hates that. So when it gets into the joint, your body gets inflamed in reaction to those crystals. The reaction to those crystals creates inflammation, which causes pain and swelling in your joints. And over time, it's even possible, again, to wear away your cartilage. And so people can end up having, gouty arthritis, which can lead them to lose their cartilage with time, in the same way osteoarthritis can, in the same way rheumatoid arthritis can. So there's all these different kind of forms of arthritis, but kind of the underlying orthopedic issue that comes from all of these is the loss of cartilage inside the joint, which leads to loss of mobility, stiffness, pain, inflammation, all the things you've heard about before. People talk about they call the old wives' tale about, I can tell when it's about to rain, but that's actually real stuff. So people who have arthritis can actually feel a difference in their joint when the barometric pressure around them changes. So when a cold front is coming in and it's about to rain, that actually affects the joint that has arthritis because the inflammation is modulated by the barometric pressure. So that's actually true. People who have arthritis can actually, in a way, tell when it's about to rain. So that's not just some myth. They didn't make that up. I want to do one last point about arthritis, and we're going to get to this in another video, but let me leave you with this before we leave. Just because you have arthritis does not mean that you're going to have a replacement of your joint. People have heard about terms like knee replacements and hip replacements, which are two of the most common orthopedic procedures ever performed. We do a lot of that. But just because you get bone-on-bone arthritis does not mean you're getting a replacement of your knee or your hip. There are people who have bone-on-bone arthritis who are living their life like nothing happened. It has a lot to do with how that bone-on-bone arthritis, so to speak, affects you. So there are things that you can do to modulate how you feel about it. So for instance, people who have a lot of excellent muscle strength around their knees can have advanced arthritis but not necessarily feel it in the same way somebody else might not. Now, I'm not saying you just strengthen your knees and you'll never get a knee replacement, but what I'm getting at is that there are things that you can control that can change the way you feel about how arthritis affects you. Even if the causes that give you arthritis or give people arthritis are bigger than us, there are factors that you can affect, and that's important for every patient to know. So maintaining strength and mobility may not stop you from getting arthritis, but it can change how you feel about having arthritis, which changes whether or not you have to get a replacement. Because I'll give you this little tidbit or nugget. Nobody has to get a replacement of any joint. Not for arthritis, at least. You don't have to get a replacement. Replacements are done if you have end stage or bone-on-bone arthritis, like we say, and if that arthritis is keeping you from living your life, being able to move and what have you. So you could have no cartilage in your knee whatsoever, but if you're able to get around and make your life work, there's no reason to have to get a knee replacement. So your goal is not to stop yourself from getting arthritis, which is a bigger picture than any of us can control. Your goal is to keep your body as mobile as you can possibly can. Keep yourself in good fitness so that you're not getting inflammation from fat deposits throughout your body, and keeping your cardiovascular health up so you can keep on moving and keep the blood flow circulating throughout you. So remember that part at least is in your hands. We control what we can, and we expect and plan for what we can't. So with that being said, I'm gonna leave y'all be. You understand what I'm saying about osteoarthritis and all different types of arthritis? Follow along, we'll keep on talking about all of these as we go on throughout the weeks. Remember, Level the Playing Field is here to give you information about orthopedics, sports medicine, and to give you a chance to understand all of these topics. We'll see you next time.